sensible in areas where you go where there are lots of mosquitoes or biting insects. We usually suggest to patients that they use antiseptic creams if they do cut their arm or leg, depending on where their lymphedema is, and that we treat other conditions that cause problems like the athlete's foot we talked about just now. There are also some other simple precautions. So if you have arm lymphedema, wearing a glove when you're gardening and cutting roses. We're back to roses again, that's good. And also if you have leg lymphedema, avoiding walking in the garden with no shoes on so that you don't get thorns or scratches from things on the ground. These are sort of sensible precautions which are worth trying to follow, I think. You can make up your own. You know the principle here about what we're trying to do. We're just trying to prevent bacteria getting into the skin. There'll be others. If I keep getting cellulitis, do I need to have low-dose antibiotics? That's what we mean by prophylactic antibiotics. That's taking a low dose of antibiotics every day to stop the cellulitis happening. In our guidelines, we recommend thinking about this if people have 2 or more episodes of cellulitis in a year. What we do if that happens is we check that we're addressing any risk factors. So if people have any skin problems, we try and address those. We try to make sure that we're controlling the lymphedema swelling as much as possible. And if we're doing all that and people are still getting cellulitis, we use a low-dose antibiotic, one called phenoxymethylpenicillin, which is an old-fashioned penicillin which has been used for years for stopping infections of various sorts, and there's a lot of experience using it. It seems to be quite effective. The research, I'm afraid, is still not there, although there's some studies coming on now which suggest it can help to stop cellulitis recurring. And we usually give our patients the antibiotic for 1 year to begin with. Now, sometimes if people are new to our clinic, in that year we may improve their skin, we may improve their lymphedema, and that will reduce their risk of getting more cellulitis. So we can then stop it or reduce the dose and then stop the antibiotic so they don't have to have it forever. But some of our patients who, despite doing all that, they still have episodes of cellulitis, we leave them on the low-dose penicillin for years, and it seems to help. We're nearly there. Some frequently asked questions. When I've talked about this sort of problem to other groups like yourself, there's some common questions, and one of them is, if I have had cellulitis and I've taken off my compression garment, how quickly can I put it back on? Now, we've sort of changed our advice. One of the things about lymphedema, as you will have picked up from Neil's presentation before me, is that there's still an awful lot we don't know. So what we might say to you now, this is the best thing to do. If in 2 years' time, we may say something totally different and totally the opposite. We've probably heard of the discussion we've been having in the conference about exercise in lymphedema. Some years ago, we were telling people to rest their limb and not do strenuous exercise. Now we've changed all that because the evidence is saying that we should change our advice. So at the moment, we've changed our advice on this. In the past, we said, leave off the garment until the cellulitis has settled. The problem with that was that because people weren't wearing their garment, then their swollen arm or swollen leg would get more swollen again, and you'd be back often to square one, needing some more intensive treatment. Now what we're saying is that as soon as it feels comfortable to put the garment back on, and provided there's no ulcers or broken skin where the garment, which the garment might cause damage to, then we're saying put the garment back on, and that's what we're mostly advising at the moment, certainly in our UK guidance. Whoops, I've jumped one, I think. Wait a minute, there we go. And the other question that people ask is, if I have lymphedema, should I have some antibiotics at home? I've said here, if you get infection on Saturday, don't wait till Monday. Should I have antibiotics at home? And this is a difficult one because, as I mentioned earlier, it's not always easy to diagnose cellulitis. If you have, as a lymphedema sufferer, have cellulitis, you know what it's like, and you'll be able to tell the professionals like me that I have got cellulitis if you've had it once. But if you've never had it, maybe you need somebody to look at it first. So what we tend to do is to reserve this for people who have had cellulitis with lymphedema, who have recurrent episodes, and many of our patients who are unfortunately vulnerable to repeated episodes of cellulitis. They keep a course of antibiotics at home, a 2-week course of antibiotics at home, and they start those as soon as they start to feel an attack of cellulitis is coming on. When people are travelling abroad as well, if they have are going somewhere where access to medical advice may be difficult, again we usually recommend that they have a course of antibiotics to take with them. But again, it's somebody who knows what the cellulitis is like, and ideally, if it's not working, will need to seek advice as well. Good. Thank you very much. That's a quick tour around cellulitis.
And I think we have some questions. Is that okay?
Yes, absolutely.
Love, do we have some questions?
Yes. Lymphedema related to Borrelia, Lyme disease, or other infectious diseases? And if you do, what are the special considerations in the treatment of these patients?
I don't think I've seen anybody in my practice with that to date. No, I see quite. I've been doing clinics in lymphedema for about 20 years now, and in our clinics that I run, we see something like 600 new people a year, and I don't think I've ever seen that knowingly as yet. So, okay.
Maybe it's more common in Sweden.
Ah, could be. Yes, yes.
Okay. Then we wonder also which patient group that needs to be given more attention at the moment when it comes to research about cellulitis. Is there any specific group that you think about that there would be need more research?
I think we know very little about the bacterial cause of cellulitis. I think that would be the most useful thing for us. Anybody with lymphedema, wherever they have the lymphedema, can get cellulitis. I think we probably see it more in people who have leg lymphedema than arm lymphedema, but you still see it with people with arm lymphedema. Some of the more difficult ones that we find to treat are people who have lymphedema in the genital area, where that can be probably different bacteria that are causing that, and sometimes they can be really quite difficult to treat and to control it. So I think any research on cellulitis would be helpful.
Yeah. Okay. And then we wonder how the palliative care for lymphedema is carried out in comparison with general lymphedema treatment. What is the main difference, you would say?
Oh goodness, that's a whole new talk.
There is the consensus document from
Yes,
ILF.
there is. I think yes, there is. I think palliative care and lymphedema is a big topic. I'm happy to say sort of in a nutshell, but I think a lot of it depends what you mean by palliative care, really. And when we talk about people with advanced cancer, for example, very rarely is what the swelling they have just a pure lymphedema. They have lots of other problems that contribute to the swelling. For example, in advanced cancer, the body doesn't produce protein as well, and so the level of protein in the blood drops, and that makes you swell up. So you can have very extensive swelling, and the treatment is often very different because of the cause of the swelling. So some of it is proper lymphedema, other is more complex, and we have to adjust it accordingly. But it is a whole topic. There is as Margareta said, there is a position statement, I think, a document, isn't there, on from the ILF on it.
I have one question, and that is lipedema and cellulitis.
Yes. The literature says that people with lipedema don't get cellulitis if you look at pure lipedema. If you consider pure lipedema as a disorder of fat deposition of adipose tissue, then there is, at first sight, no reason why they should have cellulitis. Now, some people with lipedema go on to get edema fluid on top, and we call that lipolymphedema. Very confusing terminology, I think. But I've certainly seen some patients who have that condition where they seem to have more risk of cellulitis. But there is this very complicated interrelationship between the lymphatics and adipose tissue, which Professor Ryan is much more expert in than I am. And but I think the general feeling is that if you compare the features of people with lymphedema and pure lipedema, then having cellulitis is something that the people with lymphedema get. Not having cellulitis is more typical of people with lipedema. That's the simple answer, really.
Okay. I think that's enough. And we're
Thank
very
you.
happy with your answers.
I hope this has addressed the sort of things you're concerned about. I hope that's been okay. Good, thank you.
I'm sure we're all Thank you, Rick.
Oh, how kind.
And thank you for coming.
Not at all. I will take this out. Yeah, good.
Nu har vi en ny från dig.